Hello, this is Dr. Anna Hitt-Nichols, and this is the information on the latest U.S. FDA approvals the week of December 9th through the 15th, 2023. So first up this week, we have the FDA has approved Belzutifan, that's Welireg, for patients with advanced renal cell carcinoma, RCC, following a PD-1 or PD-L1 inhibitor, as well as a VEGF-TKI, tyrosine kinase inhibitor. Belzutifan is an oral HIF-2 alpha inhibitor. This approval is the first novel therapeutic class to be approved for advanced RCC since 2015. Belzutifan is already indicated for the treatment of adult patients with von Hippel-Lindau VHL disease who require therapy for associated RCC, central nervous system hemangioblastomas, or pancreatic neuroendocrine tumors not requiring immediate surgery. The latest approval is based on data from the phase 3 LIGHT-SPARK 005 study, which evaluated Belzutifan in adult patients with advanced RCC that progressed following treatment with a PD-L1 or PD-1 checkpoint inhibitor and VEGF-TKI therapy. The latest approval was granted to Merck Inc. Also, last week, the FDA approved the PulseSelect Pulse Field Ablation at PFA system for cardiac electrophysiological mapping, that's stimulation and recording, and also for the treatment of atrial fibrillation, AFib. According to the Centers for Disease Control and Prevention, approximately 12 million people in the United States will have AFib in 2030. Untreated AFib is associated with an increased risk of stroke and heart-related deaths. The PFA system uses electrical pulses to ablate cardiac tissue. The system consists of a generator and a loop catheter that ablates tissue with fast electrical pulses that form holes in the thin membrane around each cell. That's called irreversible electroporation. And that's instead of with thermal energy, which is the conventional method. The FDA granted breakthrough device designation to the PulseSelect PFA system in 2018. In a global clinical trial of PulseSelect with 300 patients, the adverse event rate was minimal, 0.7%. In contrast to PFA, conventional thermal ablation for the treatment of AFib may lead to adverse events such as injury to the esophagus. The study also found that post-treatment, more than 80% of patients had no recurring symptomatic atrial arrhythmias. The approval was granted to Medtronic Inc. Also last week, the FDA has approved Roflumilast foam 0.3%, and that's known by the brand name Zoryve, Z-O-R-Y-V-E, for the treatment of seborrheic dermatitis in individuals aged 9 years and older. Seborrheic dermatitis affects approximately 10 million people in the United States. Roflumilast 0.3% is the first drug approved for this condition, with a new mechanism of action in over 2 decades, according to a manufacturer press release. Roflumilast foam 0.3% is a once-daily topical selective phosphodiesterase 4, PDE4 inhibitor. PDE4 mediates inflammatory responses in psoriasis and seborrheic dermatitis. This agent was approved initially in 2011 for the treatment of plaque psoriasis. The steroid-free foam can be used on hair-bearing areas of the body, such as the scalp, face, and trunk, all of which can be affected by seborrheic dermatitis. Approval was supported by positive results from the Stratum phase 3 trial. At week 8, 79.5% of patients treated with Roflumilast foam 0.3% achieved the primary endpoint compared to 58% of vehicle-treated patients. In addition, 50.6% of those treated with Roflumilast foam 0.3% reached complete disease clearance. The approval was granted to Arcutis Biotherapeutics, Inc. Also last week, the FDA has approved Eflornithine, and that's known by the brand name Elwolfen, to reduce the risk of relapse in adult and pediatric patients with high-risk neuroblastoma who have demonstrated at least a partial response to a prior multi-agent, multimodality therapy, including anti-GD2 immunotherapy. This approval represents the first one for a therapy intended to reduce the risk of relapse in pediatric patients with high-risk neuroblastoma. Eflornithine inhibits ornithine decarboxylase, which exhibits high activity in tumor cells and decreases cell growth and division of both cancerous and non-cancerous cells. That's the eflornithine, that is, not the ornithine decarboxylase. According to the American Cancer Society, 700 to 800 cases of neuroblastoma are diagnosed in the U.S. each year, with 90% of diagnoses coming before age 5, with over 50% of these cases being classified as high risk. The approval is based on the results of a multi-site study of children with high-risk neuroblastoma who received eflornithine as maintenance therapy following standard of care treatment, including immunotherapy. The approval was granted to US World Meds LLC. The FDA has also approved isavuconazonium sulfate, that's also known as Cresemba, an azole antifungal drug for the treatment of invasive aspergillosis and invasive mucormycosis in pediatric patients. The injection form of this agent was already approved for adults and is now indicated for pediatric patients 1 year of age and older. And then also in capsule form, this agent is approved for adults and pediatric patients 6 years of age and older who weigh 16 kilograms or more. According to a press release from the manufacturer, Astellas Pharma, with this approval, Cresemba is now the only azole antifungal therapy approved for the treatment of IA and IM in patients as young as 1 year of age. Invasive aspergillosis can be a life-threatening fungal infection that's seen predominantly in immunocompromised patients, such as those with leukemia. Invasive mucormycosis is a rare and often life-threatening fungal infection. Both are a major cause of morbidity and death among immunocompromised and hospitalized pediatric patients. This approval is based on results from 2 pediatric clinical studies. Also last week, the FDA has approved a drug-releasing implant designed to reduce intraocular pressure in patients with ocular hypertension and open-angle glaucoma. Travoprost intracameral implant, known as iDose-TR, is intended for a single administration per eye and continuously delivers a formulation of travoprost, which is an established treatment for glaucoma. According to the manufacturer Glaukos, the implant will provide patients with an alternative to eye drops and remove the risk that noncompliance with the treatment regimen will affect outcomes. The implant is anchored into the anterior chamber of the eye and gradually releases a highly concentrated formulation of travoprost to provide continuous treatment for high ocular pressure up to 3 years. The approval is based on results from 2 phase 3 trials, GC010 and GC012. Approval was not granted for repeat dosing, but the company has indicated plans to work with the FDA to change the label. Also last week, the FDA has granted approval to NuLoupes, that's NuLoupes, augmented reality smart glasses, 3D stereoscopic technology. The glasses offer practitioners in dentistry and medicine 3D visualization, allowing them to move from traditional fixed magnification to high-resolution variable digital magnification and 3D stereoscopic imaging with near-zero latency. NuLoupes are the first pair of smart glasses that feature live 3D stereoscopic imaging to receive FDA clearance. New Eyes, the manufacturer, plans to begin shipping developer kits in the first quarter of 2024. Is your company in need of medical writing assistance? Visit our website at nascentmc.com. That's nascentmc.com. Our native English-speaking MD and PhD level medical writers create fast turnaround needs assessments, medical news pieces, manuscripts, slide decks, ad boards, summaries, and much, much more, all for the price of what you would pay a single freelancer, but with a much wider selection and with freelancers with a background in the specialty that you need. Nascent Medical, we're here so that you never have to be without excellent medical writing help. Go to nascentmc.com. Also, last week, the FDA has cleared the OneRF ablation system, which is a brain electrode-guided tool used in neurosurgical procedures, including those for Parkinson's disease. The removal of small, specific regions of the brain in Parkinson's disease may help control motor symptoms. The OneRF ablation system is designed to capture electrical activity and selectively destroy nervous tissue within controlled temperature settings. OneRF includes EVO stereo electroencephalogram electrodes, which have already been approved for recording and stimulating brain activity. The newly cleared system adds a component that allows the targeted ablation of brain tissue. According to the manufacturer NeuroOne, the OneRF system may also be used for other neurological conditions such as epilepsy, involuntary muscle contractions, and essential tremor, among others. The manufacturer plans to launch the device in the first half of 2024. Also last week, the FDA granted fast-track approval to the CSF1R inhibitor pimicotinib, it's also called ABS-KO2, for the treatment of tenosynovial giant cell tumor, TGCT, in patients with tumors not amenable to surgery. Pimicotinib was previously granted breakthrough therapy designation in January 2023. TGCT is a locally aggressive neoplasm that typically affects synovial joints, mucous sacs, and tendon membranes, resulting in swelling, pain, stiffness, and decreased activity of the affected joints. Pimicotinib is an orally available, highly selective small molecule CSF1R, that stands for colony stimulating factor, 1R inhibitor, and is now entering into a phase 3 trial of TGCT. Upon 1-year follow-up in a phase 1b trial of patients with TGCT, pimicotinib demonstrated an overall response rate of 87.5%, and that included 3 complete responses among 32 patients, and that was in the 50 milligram once daily cohort. Pimicotinib is manufactured by the Chinese company Abisco, which has entered into an agreement with Merck for commercialization of pimicotinib. And lastly, this week, a new drug application has been submitted to the FDA for consideration of MDMA. It's known by the chemical name 3,4-methylene dioxymethamphetamine, and also called midomethaphamine capsules. That's in combination with psychotherapy for individuals with post-traumatic stress disorder, PTSD. If approved, MDMA would be the first psychedelic-assisted therapy approved for PTSD. The NDA is being submitted by the MAPS Public Benefit Corporation. That's a San Jose-based company, which describes itself as a clinical stage company dedicated to changing the way mental health conditions are treated. The NDA submission included data from 2 randomized phase 3 clinical trials, MAP1 and MAP2, evaluating the efficacy and safety of MDMA-assisted therapy versus placebo in patients with PTSD who were treated with psychotherapy also. Both MAP1 and MAP2 studies met their primary and secondary endpoints, and findings were published in Nature Medicine. The FDA granted breakthrough therapy designation to MDMA in 2017, and the company has requested a priority review of their NDA. All right, that's it for this week. I am not sure if we're going to have a publication or a podcast episode coming out next week or the week after, because that will be Christmas and New Year's Day, although maybe we'll load something up that isn't necessarily like breaking news. Maybe we'll do something different. Not sure. Anyway, if you don't get an episode, I just wanted to wish you a wonderful Christmas if you're celebrating, and certainly a happy new year. I'm so excited about 2024, all that's coming down the pike, and I hope you are too. I think it's going to be a good year. Of course, you just never know, right? But anyway, if I don't talk to you, I will talk to you next year, and have a wonderful holiday. Thanks.